ashver.com.
Hello and welcome to ashver.com. You are watching an interesting and informative video on major causes of bump on roof of mouth. Please read the disclaimer carefully. A lump is an abnormal enlargement that could be present in different parts of the body. Hence, the presence of a bump or lump in any organ may denote a functional impairment or a physiological reaction to an external stimulus. Lumps usually appear in delicate and fleshy portions in the body. Among the most common areas for growth is the roof of the mouth. Nonetheless, seeing a bump on roof of mouth does not automatically denote an abnormality. More often than not, a lesion in this area is benign and treatable. If you notice a bump on roof of mouth, consult your dentist immediately. Despite a low chance of malignancy, this must still be treated right away in order to prevent abnormal enlargement. Once the lesion increases in size, it becomes more difficult to remove. Possible causes of lumps on the roof of the mouth. Torus palatinus. Several factors can cause the enlargement of this portion of the mouth. A bump on the roof of the mouth may denote the presence of torus palatinus. This lesion is a normal bony elevation that occurs in the middle portion of the hard palate. The increased growth is made up of mineralized bones that do not contain a medullary cavity. Torus palatini are normal bony enlargements that increase in size as a person ages. Most researchers also claim that the propensity of having torus palatinus is largely heritable. The gene that causes this lesion is passed on to succeeding generations due to heredity. Statistics depict that Asians and Native Americans are mostly afflicted with the condition. Other external factors that may cause the lump are frequent grinding of teeth and constant irritation of the palate. Several symptoms are present among individuals who have palatal tori. First, the skin has increased sensitivity, which leads to easier damage of the palate. For people with prosthesis, it also becomes more difficult to place and remove it. Second, the enlargement causes an obstruction in the passageway of food into the digestive tract. Eating and drinking become more difficult due to the lesion. Third, you might feel pain due to inflammation caused by the infection. Since the presence of palatal tori makes food consumption difficult, you must visit your dentist immediately after detecting a possible outgrowth. If the mass is not large enough, your dentist will probably just give you medication for the pain. This does be removed unless it impedes normal function. However, if it enlarges and obstructs your dentures, this will be removed through a surgical operation. A maxillary tori reduction surgery is a procedure that involves an incision in the mid-palatal region to remove the palatal torus. After surgical removal, most patients have good prognosis. Since the passageway of food is no longer blocked, eating and drinking become easier. Prosthetics also no longer cause pain. Although there is a possibility of complications such as bleeding and swelling. Possible cause of bump on roof of mouth. Mucocele. A mucocele is a distinct lump caused by blocked salivary glands of the oral cavity. Normally, saliva drains from the glands to the mouth. However, when the ducts are obstructed, saliva cannot be released into the oral cavity. Mucus secretions also accumulate in the ducts, causing an overgrowth. An obstructed salivary gland is primarily caused by frequent biting of the cheeks. This may also occur when the face experiences trauma, such as when your cheeks are suddenly hit. Before you freak out, you have to remember that this is a benign cyst that can be easily treated. Since salivary glands are spread all throughout the mouth, mucocele may appear in different areas of the oral cavity. These appear as bluish, dome-shaped outgrowths in the lower lips, tongue and roof of the mouth. Generally, small mucocele do not cause any harm in the mouth. These are usually soft and range from 2 to 10 mm in diameter. Dentists usually do not prescribe anything because mucocele are painless. However, an enlarged bump on roof of mouth may cause referred pain in the entire oral cavity. If this occurs, consult your dentist immediately. Do not try to prick or open this lesion yourself, because this may bleed internally. Two types of treatment are often recommended by dentists and oral surgeons. First, the removal of damaged salivary gland may be done. This can be conducted with the use of either laser or surgical incision. Anesthetics are also applied in order to reduce pain. Second, marsupialization may be done to form a new duct to drain mucus and saliva. This technique is conducted to release the fluid that has Epstein Pearls. A bump on roof of mouth of a newly born child may also be caused by Epstein Pearls. Just like the conditions that were previously mentioned, Epstein Pearls are benign cysts that are normal among approximately 80% of infants. Also called palatal cysts of the newborn, these nodules are white or yellowish in the median raphe of the palate. In some cases, these teeth-like lesions also appear in the gums of a newborn. Epstein Pearls are caused by formation of skin that becomes trapped during palate formation. During the development, a certain epithelial lining covers the palate. However, if a thickened portion of the epithelium is enclosed during closing of the fissure, this cyst-like outgrowth forms. These nodules do not require treatment because they usually subside within the first 2 weeks after birth. If the Epstein Pearls still predominate after 2 weeks, it would be best to contact a physician. Oral cancer. A bump on roof of mouth may also be caused by oral cancer, which is the presence of a malignant outgrowth of cells in the oral cavity. Often termed as the head and neck cancer, this disease of the oral cavity affects the lips, cheeks, palates, tonsils, oral glands and tongue. This condition is characterized by dark, irregular lumps scattered in various areas of the mouth. Most cases begin in the tongue and lips before a bump on roof of mouth appears and metastasizes. Some risk factors for oral cancer are smoking, drinking alcohol, exposure to ultraviolet light and HPV infection. Individuals who use tobacco while drinking have increased likelihood of developing oral cancer. Researches also show that heredity plays an important factor in inheriting this cancer. If you have a family history of excessive drinking and smoking, you are more prone to developing oral cancer. Oral cancer is mainly caused by the abnormal proliferation of damaged cells in the oral cavity. Instead of undergoing apoptosis, mutated cells increase in number until they form a mass of tissue. When the tumor becomes malignant, it develops into a cancerous cell. These cancer cells invade different organs such as the neck and lungs, which leads to the destruction of normally functioning cells. Some symptoms of oral cancer are the proliferation of dark spots in the mouth and lips, bleeding, having uncompact teeth and difficulty in swallowing. If you have these symptoms, consult your doctor right away. A cancer is often diagnosed and staged through biopsy. This step is essential because the condition may be treated depending on the extent of metastasis of the cancerous cells. The most common options for oral cancer treatment are surgery, chemotherapy and radiation therapy to kill the damaged cells. Pain medications are also regularly provided to reduce the side effects of treatment procedures. A bump on roof of mouth may be present due to different conditions. Some lesions may be present due to benign causes such as torus palatinus, mucocell and Epstein Pearls, or a malignant disease like oral cancer. No matter what the cause may be, it is important to have sufficient knowledge about these conditions before consulting your dentist. Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.